Welcome back to Health in Today's Woman. In our first segment, we talked a lot about what a physiatrist or a physical medicine rehabilitation specialist actually does. In this segment, I want to take a little bit more of a look at a specific idea that they treat, and that's the whole idea of chronic pain. We have Dr. Bill Newton, who's a physiatrist or physical medicine rehabilitation from the Murfreesboro Medical Clinic with us today. I want to ask you a little bit about this because you do a lot with chronic pain. Give us a little bit of an idea of some of the things that you do in your practice for chronic pain, some of the basic stuff. I know you do some, so you talked about physical medicine rehabilitation type stuff, but you also do invasive procedures. Is that correct?
Yeah, absolutely. The idea of pain management is a multimodal approach, and that's a combination of what I tell patients about is different tools in the toolbox. Okay, you have therapy, you have medications, you have surgery, you have other topical treatments, which may be things like electrical stimulation or TENS units or things of that nature. And then there's this whole area of what we call interventional pain management. Okay, interventional pain management, kind of by definition, is a use of minimally invasive procedures that are usually targeted towards the muscle or the nerve or some structure in the body that may be the source of the pain. Most of these procedures are targeted in the spine, be it the neck or the middle back or the lower back, but there's a full spectrum of procedures that are done outside of the spine, dealing with hips and knees and actual nerves in the peripheral nervous system that can become entrapped and can become problematic.
Now, one of my questions to you too is that we would start looking as far as a patient perspective. What kind of patient can come see you? Any patient with pain, or are there certain patients that are more geared towards coming to see you? Yeah,
my attitude is my door is open to everybody. The challenging part is finding the right provider who can manage pain, whether it's acute pain or chronic pain. If you think about medicine in general, if you think about what takes people to the doctor, in most cases it's pain, whether it's abdominal pain or pelvic pain, or it could be having shoulder pain or knee pain. The key is it's pain, so what's the best provider for that? Where do you go? And in most cases, pain resolves. It gets better. It just takes time. It takes time, it takes therapy, it takes the right combination of all these tools together to provide the best care. So the kind of patient that I would see is, and what I tell my primary care referrals is, if you have a patient that has pain that you cannot adequately control, send them to me. I don't really need to know much about them. Whether they have ear pain or eye pain. If it's something I can take care of, I'm going to take care of it. But if it's something that I think needs a specialist referral, say an ophthalmologist or an ENT or an OBGYN, I'll send them down the right path, the right direction. And sometimes it's hard for primary care physicians because they may not know the answer. So they reach out to us as specialists to help them with those answers and ultimately to help the patient.
And one of the things that we've discussed this on numerous occasions at different times, one thing I really like about your specialty and about you is this whole multimodal approach. I think that's where medicine's going. I think the opportunity, as we've discussed before, of having not just one person's trying to make your decisions, but a group of physicians working together to make your decisions is such an important idea. One of the things I wanted to kind of turn this to is, I'm a patient, let's say, and I've got pain. There's tons of pain clinics out there. What draws me to you versus somebody else? I know a lot of anesthesiologists, for example, will have pain clinics. What kind of criteria do you look at that a patient should look at when they're looking for some kind of pain center?
Well, one of the problems that we're dealing with nationwide is the spawning of all of these pain clinics. Tennessee is not doing very well right now, Florida as well is not doing well with these ideas of pill mills, where these small clinics are opening up, usually are staffed by nurse practitioners or physician assistants, not necessarily without any direct oversight by a licensed physician, are providing essentially narcotic pain management for a lot of these patients, which in many cases may be appropriate, but they need to have the appropriate evaluation. In this area, typically the true pain management clinics are either run by anesthesiologists or by physiatrists, physical medicine and rehabilitation. But they're all different. Some are multimodal, where they may do therapy and may do medications and may do these interventional spine injections as well. And some are purely interventional, where that's all they do is injections. So the patients really have to be educated to know what's the best place. Now, me, of course, I'm going to be biased and say the best place is a place that's going to look at you multimodally with all these different modalities, and not just be focused on intervention and using that needle and trying to do the injection as the first line. First line is always conservative care, therapy, rest, lifestyle modification, and then branching off onto that, doing more invasive and interventional things. Absolutely.
Okay, and I think it's important. We're not here to dog anybody or put anybody down. It's just a matter of different opinions, and we want to make sure that is addressed.
Yeah.
When we come back, we're going to take a look at a specific pain syndrome called fibromyalgia. You may have heard of this, and I was so glad to have Dr. Newton here. He's going to be able to explain this to us a little bit better. We'll see you after these messages.